So Adventist is associated with two family medicine residency programs. One, the Hanford Family Medicine Residency Program is sponsored by Adventist, so we're responsible for all the education that occurs there. Family medicine is a 3-year program where you learn the full range of medicine. UCSF Fresno has its own family medicine program as well as a number of other residency programs. The family medicine program through UCSF works out of Reedley Hospital.
One of the key things that I think stood out to me from the program here that is within Adventist Health, we would be able to practice in a big hospital all the way down to a rural setting. You know, you get to learn both pieces of the community. And I think that combination was really important for any resident, really. You know, you're gonna be able to really go anywhere after this program. You can be in a big city or you can be in a small town. The residents that have graduated from here have gone on to do all kinds of stuff.
The program was amazing because it really did make me feel like I can do anything as a doctor. I was able to experience both the kind of an urban setting in Fresno, but then also the rural setting. You get to use all the skills that you learn in the big hospital from all the specialists and apply it to the rural setting. The training here really builds strong physicians who are equipped to handle anything.
Our residency not only practices in the clinic here, but we practice in the inpatient service. So we admit adult patients, and we also deliver babies and kind of carry on that newborn care. So it's a really unique setup, because what's different about Adventist is that it's set up as a rural system. So it's got the clinics, like as an example right here, where it's built into the hospital. So you can be seeing a patient in clinic, decide that they need to go to the ER, and it's 2 steps away. And then from the ER, decide that they need to be admitted, and that's 5 steps away. And so they're in that same setup. So you can be seeing your patient in clinic, walk over to the hospital, see the patient who's admitted, deliver a baby, you know, in the building next door, and then have the baby follow up with you in clinic the next day. So it really gives the residents an opportunity to experience what being a rural physician is.
There are a number of benefits to having a residency program in your institution. One of them is that our residents tend to practice in the area. So the Central Valley is a underserved area, so there's fewer physicians in the Central Valley than you say the Bay Area or Los Angeles. And it's hard to recruit to this area. And bringing residents in where they can learn about our community, get comfortable here, make friends, buy a house, start to put down roots, all those tend to keep them here in the community. And that's what we see, is that the majority of our resident graduates continue to practice in rural and underserved communities in the Central Valley, which is a huge contribution.